Good morning, guys. Hello. My name is Franca Wanogo. I'm a student of Stockholm University, Manchester, and my student ID is S329287. And today we'll be talking about the role of parental involvement in supporting children's mental health post-pandemic. And it's a great topic. It's a big topic and it's very elaborate. It talks about the mental health in the health system. It talks about the social mental health in the health system, and this is a very great topic. And the pandemic creates major destruction in children daily lives. Many children face anxiety and emotional stress because of their school routine, school social interaction, social gathering, and so many other things. With schools closed, social activities limited, children had fewer outlets to express themselves and connect with others. As a result of their mental well-being was significantly affected. During this period, parents become the main source of support. They were responsible not only for their children learning, but also for maintaining emotional stability at home. Therefore, understanding how parents influence children mental health in critical and the post-pandemic recovery. This is very, very important. The parents were there off and on, doing everything to make sure the children come back to stability, come back to their normal lives. In this study, the focus is on is why every parent's involvement is so important in helping children regain emotional balance after the pandemic. Parents play a role in reorganizing early signs of emotional stress and distress and seeking help when needed. Maybe going to the social welfare, asking, engaging in other programs to bring back the children back to the society, by staying engaged, by creating supportive home environment, cleaning their homes, make sure the COVID doesn't affect anyone around the homes, and by staying engaged that strengthens children coping ability and emotional control. The parents have so many things to bring back the children back to the society. The parents play a major role. The parents play a very significant role in this post-pandemic world. Collaboration among parents, teachers, and mental health professionals has become essential to ensure that the children receive continuous psychological support. This is very, very important. Thanks. Bye, guys.
Hello everyone, my name is Jacqueline Nieves Vidal. I study Health and Social Care at Suffolk University in Manchester. We had a topic when we had to talk about the role of the parents on the children's mental health at the pandemic. All of us lived that unprecedented time. Parents became deeply involved helping their children cope with the fear with getting infected again, and they have to be there to listen them, to help them, to let them know it was okay to feel angry or anxiety or concern about to getting infected again. So the parents help the children introducing routines, encourage them to make physical exercise, and the parents help looking for help in the different government institutions and school staff. The government offer online help for the parents because in that time the interview face-to-face was avoided. Also because of the shortage in the old branch and NHS and school staff. The parents had to be forced to looking for another way to how they can help their children, and all of that support was online. And they have, a lot of them have a bit knowledge about technology, and they have to be forced to new things taught. So how can they help their children and letting their children they be there to help them to how to introduce it again into the normal life, back to normal, go to school, go to walks, go to shopping. So the parents' role were crucial in that time, helping the children supported by the government institutions, and all of them work together for the children.
Hello everyone, my name is Zainabu. I am here to do my presentation about the topic, the role of the parent environment in supporting children's mental health during the COVID-19 is very important because it's a role crucial in emotional stability, educational support, family bonding, and mental health strength. Education support as online schooling beginning and children starting learning. From online, parents is helping children took on the additional role of educator. Their role is their involvement help maintains learning routines and academic motivation, especially for children and family bonding. The support with the family provides guarantee of the UK families on a low income who are raising a disability or seriously ill children. The grants can cover family breaks, days, trips, computer, and scenery, toys, all with supporting family bonding. The educational support is parents served as the primary source of comfort and helping children's process fair and confused, empathic, opening communication, and emotional validation, become protective, emotional validation, factor against mental health distress. Mental health, the COVID pandemic affect children's mental health through isolation, disrupted routines, and learning challenge. Parents play a role.
Hello everyone, my name is Bella Mvaka. We're going to speak about the role of parental involvement in supporting children's mental health post-pandemic. The parents need to providing emotional stability to children affected by the pandemic by having an active communication with children to understand how they are feeling, to understand the need, and also to identify the early sign of stress or depression. Critical analysis.
We all lived through the pandemic era. Parents have been deeply involved in helping their children to readjust to the social and academic environment. Many parents with little knowledge of modern technology were forced to learn how to use those tools to help their children and teenagers overcome the fear of reintegrating into society and schools, supported by the NHS and the government. During the post-pandemic period, parental involvement in supporting children's mental health play a crucial role in supporting emotional stability, educational support. After the pandemic, children and young people mental health issues increased significantly, and some were on the waiting list for months and even years. The mental health of some children and young people deteriorated during this pandemic due to the shortage of qualified staff in the health sector. As during restriction, children rely more on social media for their interaction with others. Due to COVID-19, many countries implemented emergency plans such as lockdown and closure. Thank you very much.
Hello everyone, my name is Floris Jesse, and I am here to talk about the role of parental involvement in supporting children's mental health post-pandemic. That is the practical implications. So I'm going to talk about a few practical implications, or the few factors that contributed to children's mental health during the COVID-19. COVID-19 related impact: financial income and loss, decrease in social support, risk factors for children maltreatment during COVID-19, parents or caregivers mental health difficulties, parents or caregivers stress, parents or caregivers substance use, increase in family conflict, predisposing factors, socio-economic status, intergenerational trauma or abuse, biological factors, mechanisms, emotion regulation, social relationships, reward responsiveness, child maltreatment. And under the child maltreatment, there is child and adolescent mental health. Social implications: during the lockdown, social distancing and school closures limited children's ability to play and interact with others. Physical implications: younger children missed opportunity for physical play, which resulted in affecting their confidence and body awareness. COVID-19 has had a significant impact on mental well-being of many children and young people. Emotional abuse is involved in most child abuse cases and is recorded as a specific concern for over 1 in 3 children on a child protection plan or register. That is in the UK 2024 to 2025. Childline counseling sessions: more than 2,600 sessions with children about emotional abuse that was recorded in 2024 to 2025. Police recorded nearly 59,000 offenses in 2023 and 2024. These are some of the factors or the practical implications of the COVID-19 post-pandemic. Thank you.
Hello everyone, my name is Judith A.J. Craig. I'm a student of University of Suffolk, Manchester. I'm here to conclude the subject, the role of parental involvement in supporting children's mental health post-pandemic. The period of homeschooling during the COVID-19 pandemic was a distinctive episode for children in special schools and their parents. Survey findings like these provide an opportunity to assess. Parent-teacher factors were a source of much-needed support, and further exploitation of the dynamics of this relationship could help inform the development of a prototype to maximize parental involvement through tailored provision. The COVID-19 pandemic affected children's mental health through isolation, disrupted routines, and learning challenges. Open communications allow children to express their feelings safely, restoring their daily routines and encouraging social activities and stability. Parents should model healthy coping strategies, promote good sleep, exercise, and a balanced diet, and create time for relaxation and play. If emotional difficulties persist, seeking professional support is needed. Thank you.